Lupus, it's a disease you've probably heard of, but may not fully understand. What exactly is it? And how do you know if you or someone you care about might have it? Today, we're talking about what lupus is, the signs and symptoms you should look out for, and when it's time to see a doctor. Let's break it down. What is lupus? Signs, symptoms, and when to see a doctor. 1. What is lupus? Lupus is an autoimmune disease, which means your immune system, the body's defense system, mistakenly attacks healthy tissues. This can cause inflammation and damage to various organs and systems in the body. There are several types of lupus, but the most common one is systemic lupus erythematosus, SLE. It can affect almost any part of your body, which makes it tricky to diagnose because the symptoms vary so much from person to person. Lupus can range from mild to life-threatening. The key is early diagnosis and treatment to help manage the symptoms and prevent serious complications. 2. Signs and symptoms of lupus. The symptoms of lupus are often confusing because they mimic other conditions. Here are some of the most common ones. Extreme fatigue. Not just feeling tired. This is exhaustion that doesn't go away with rest. Joint pain and swelling, especially in the hands, wrists, and knees. Skin rashes. The hallmark lupus symptom is the butterfly-shaped rash across the cheeks and nose. But other rashes can also appear. Hair loss, often linked to inflammation in the scalp. Fever without an obvious cause. Chest pain or shortness of breath, which can be signs of inflammation around the heart or lungs. Kidney problems, which may show up as swelling in the legs or high blood pressure. Lupus symptoms can come and go in flares, periods when the symptoms get worse and periods of remission when they improve. This unpredictable pattern makes lupus even harder to identify. 3. Who's at risk? Anyone can develop lupus, but some groups are at higher risk. Women are much more likely to have lupus than men. About 90% of cases occur in women. It's more common in people of African, Hispanic, Asian, and Native American descent. Lupus often develops between the ages of 15 and 44. Family history, certain infections, and exposure to sunlight can also increase your risk. 4. When to see a doctor. So, when should you see a doctor? If you're experiencing persistent symptoms like fatigue, joint pain, or rashes that don't go away, it's time to get checked. If you have a family history of autoimmune diseases, be extra vigilant. And if you've already been diagnosed with lupus, regular checkups are essential to monitor your condition. Lupus can affect different organs in different ways, so your doctor might run several tests, like blood tests and imaging, to make a diagnosis. 5. Living with lupus. The good news is that while lupus is a chronic condition, it can be managed. Treatment typically includes medications to reduce inflammation and suppress the immune system. Lifestyle changes, like eating a balanced diet, managing stress, and protecting yourself from the sun, can also help. Final thoughts. Lupus might be complicated, but understanding the signs and symptoms can help you catch it early. If you're worried about lupus, don't wait. Talk to your doctor. Early diagnosis and treatment can make all the difference. Stay informed and take care of your health.